give you a nice traditional adjustment. Here we go. And your neck is doing better. I feel less tension here, less swelling, and less inflammation than the way you came in. But you could still feel that this is not right here. Can you feel what I feel?
Yeah.
That's swollen and tender. I'm gonna rub your back. How's that feel?
It feels good.
Good for you. Here we go. Now I'm going to stretch you out because you've had some back pain. We're going to do some advanced tests today. A special leg length analysis. The same tests used by thousands of doctors worldwide. I'm going to stretch you out a little bit this way, do some traction. How you feeling? Is this okay?
Yeah.
Alrighty. I'm going to use massage instruments on your shoulders and back. And these are special acrylic massagers that we give out to new patients on their second visit. How's that feel?
Feels good.
Here we go. We'll work the shoulders. We store stress here, characteristically. People are sitting at computer terminals and their shoulders get really tight. So these acrylic massagers do a nice job at getting into the muscles that support the spine and keep us standing and feeling strong. I'm going to work to get some of the stress out of the shoulders and work on the muscles on the sides of the vertebrae. Comfortable?
Yeah.
Alrighty. And I'm going to do a leg length analysis. This looks good. This looks nice and even, and it should. One leg should be as long as the other. And I'm going to lift your legs. Now that looks nice. And the feet should be even in each test. And I'm going to have you put your right arm on your lower back, please. That looks good. And that's even as well. Arm back to your side. Left arm on your lower back. And that's even too. Arm back to your side. Good. So far, so good. Put both arms on your lower back. When she puts both arms on her lower back, the right leg shortens just a little bit, which lets me know it's the second lumbar vertebra that's subluxated. Bring your left arm to your side. Put your right arm to the side of your head, please. And that's nice and even, and it should be. Arm back to your side. Left arm to the side of your head. So these are tests for the spine and nervous system. Arm back to your side. And in each test, ideally the feet should stay even, and she's doing quite well. Put both arms over your head, please, Lynn. When she does that though, the right leg comes short, which indicates the 8th thoracic vertebra is out of alignment. Arms to your sides. Turn your face to the right. Good for you. Right hand to the side of your head. Turn your face to the right. Right hand. Good. Arm back to your side, please. Head in the center. And lift your head up and relax. When she lifts her head, the right leg shortens again. Tuck your chin in and relax. And look over your left shoulder, please. So I'm going to give her a beautiful adjustment for lower back, mid back, and neck. But I'd like you to lay on your left side and turn and face me, please. And you can let your leg go forward. And in just a second, you might feel a click in your lower back. Here we go. And we'll just relax you and I. Yes, ma'am, that's beautiful. They heard that downtown. Go ahead, lay on your back. Here we go. People are wondering what it might feel like to get adjusted. What would you tell someone who's maybe afraid of chiropractic or unfamiliar with chiropractic adjustments? How does that feel?
Feels better when it happens. It feels alleviating.